Much better, I think.
Well, Dr. Spiegel, thank you so much for joining me today.
You're welcome, Arlena. Glad to be here.
I'm going to try really hard not to fangirl and be professional, but I'm so excited that you're here
That's nice.
today. Yeah.
Go for it.
Yeah. No, I got really interested in hypnosis a couple of years ago. I reached out to somebody in my local area. I was like, you know what I need? I need some rewiring of my brain. There's all this talk about neuroscience and how you can rewire your brain so that you can change behaviors, which is what we'll be talking about. So I went to this gal and had an amazing experience. And I was like, I have to incorporate this in the work that I do. So I've been obsessively studying it. And of course, I came across information. You've written over, is it 480 journal articles at this point?
Something
13
like that.
books.
460, that's right. Yeah.
I felt so silly because after we talked, I was like, congratulations on your article. And you're like, yeah, that's just another day in the life. That's awesome.
Thank you. Thank you.
But I think it's really incredible the work you're doing. I'm very interested in the work you're doing around breath work with Dr. Andrew Huberman. I'm a huge Huberman Lab podcast fan.
Sure.
So I'm going to ask you about some of that stuff too. I promise I'll get to a question, but to
I'm glad to listen to you. That's fine.
You're used to that, right?
Right. It's my day job, right?
That's amazing. But I kind of wanted to frame the discussion. You know, I see everything through the lens of recovery. Like, how can I help facilitate healing for people that struggle with addiction issues?
Yes.
Whether it's drugs, alcohol, food, there's all kinds, right? But it all boils down to, I'm just going to call it addiction for the sake of our discussion. And I'm really interested in also not just addiction on the surface level, like how to handle cravings, maybe the triggers like anxiety or depression that cause people to drink, but also the underlying trauma that people have that sort of lead to addiction. But let's start off at the very beginning. Let's talk about like what hypnosis really is, because I think there's a lot of misunderstanding with all these stage hypnosis people.
Yes. Yeah. Unfortunately, that's true. It's sort of like understanding modern psychopharmacology from guys who sold snake oil, you know. You don't want to do it. Hypnosis is the oldest Western conception of a psychotherapy. It's the first time a talking interaction between a doctor and a patient was thought to have therapeutic benefit. It started about 250 years ago. So it's been around for a long time. But as you note, Arlena, it's been kind of mischaracterized by people who saw a stage hypnosis show somewhere and watched the football coach dance like a ballerina and think, oh, that's what it is. It's either silly or dangerous or both, you know. But it's actually a very powerful therapeutic tool. And what have you ever gotten so caught up in a good movie that you forgot you're watching a movie and entered the imagined world? And later on, you may have thought about it and said, well, you know, it was a little implausible, or that actor wasn't so good. But at the time, you're in the movie, not in the audience. And hypnosis is like that. It's a narrowing of the focus of attention. And coupling, so you can concentrate on certain things very intently, but that means you put outside of conscious awareness other things that could be in consciousness but aren't. And so you dissociate, you disconnect. And part of what that allows you to do is to be cognitively flexible, to see things from a different point of view. When people are stuck in addictions of one kind or another, they're sort of, it's like a rutted pool table. You know, the ball will always go down the same track. And you don't think differently about what's going on. And the key to a good therapeutic intervention is one that gets you to be cognitively flexible. So you think differently about what's going on. Now, if you're worried about suggestibility, you think, oh, well, I could learn to think the way that person thinks, and maybe that's not a good idea. Well, maybe it's not, but if it happens to be a good idea, that's a real therapeutic opportunity. And so hypnosis.
Sorry to interrupt you,
no, go right ahead.
But is that sort of like adding context to a belief? Like, you know, little kids, you know, maybe they go up to mom all excited about something, she snaps at them, they walk away with this feeling like I'm bad. and so does it add in that suggestibility phrase, does it allow for adding context so that a person can sort of reframe their beliefs about themselves?
Yes, I think that's a good. In fact, one of the things that we found in doing neuroimaging of hypnosis is that one of the things that happens is you have inverse connectivity. That is, when one region's active, the other is inactive, between the prefrontal cortex, where we think and plan, the part of my brain that and yours that's hopefully working at the moment, and you disconnect from the posterior cingulate cortex. That's part of what we call the default mode network. It's the part of your brain that's active when you're ruminating about yourself. You're thinking, who am I? What am I? And so it means that you can immerse yourself in a current activity that is disconnected from your usual set of expectations and beliefs about who you are, what you can do, what you should do, who you are. So just your example with a child feeling hurt and I'm no good and mommy doesn't love me will tend to inhibit the child from engaging in activities that the child thinks might stir up that same reflection on him or herself. The nice thing about hypnosis is you can try something that you ordinarily might not have tried. You may find that it's great. You may find that it's not, but it kind of frees you from your usual repertoire of associations and activities. And so it's a great therapeutic context for a good therapeutic approach.
Right. So I interrupted you. You were going to talk about, I think you're going to lead into like the salient network.
Salience. So yes. So the other thing that happens in hypnosis, we found, is you turn down activity in the salience network. Now, the salience network is your alerting system. It's the thing, you hear a loud noise, you think what's going on, and you shift your attention away. It matches patterns, and there are patterns that go along with normal, quiet, everything's fine activity, and there are patterns that come where there's potential danger. It's a network that gets played a lot by social media, which will float some threatening little thing by you on your screen, and you think, oh my God, I better see what that is. So it's constantly disrupting your flow of attention. And in hypnosis, you turn down activity in that region. So you're less likely to be distracted by things that might keep you from focusing. So it assists this narrowness of focal attention. And you also increase connection between the executive control region, the prefrontal cortex, and the insula, which is another part of the salience network, but it's one that's related to mind-body connection. So your brain controlling your body, feeling how your body is doing, what we call interoception, goes through the insula. So you're in a mental state where you're less likely to be distracted, you're better connected with your body, and you're disconnected from the things that normally govern your view of who you are and what you should be doing. And that's a very propitious mental set for trying out a new point of view and seeing how it feels.
I think it's so interesting you talk about dissociation, because I've always heard of that term in context of, when somebody is having a trauma experience, they dissociate, or
Right.
If someone is like in survival mode, that you hear people in recovery talk about, you're sort of in survival mode your whole life. It's hard to get out of it in adulthood. And when I talk to people or work with people that are early in recovery, I've been using maybe the term incorrectly, dissociated from their true feelings. They're so in survival mode, like being a people pleaser or something like that, that when we ask people, what do you want? They're so dissociated from their own wants and needs that they can't even tell you what they really want or need. But you're using this. So this is like healthy dissociation versus dysfunctional dissociation.
Well, and it's not, I would say in defense of people who do that, it's not always dysfunctional. It may be necessary to get by in traumatic situations. The problem is when you keep doing it, when you're no longer in a traumatic situation, it stops being so helpful and starts to become the problem. So, trauma, people who have been physically or sexually abused, people in accidents and things like that, is fundamentally the experience of being made into an object, a thing. We don't like that. We like agency. We like to be in control. But when you're being beaten or chased or sexually assaulted, most rape survivors experienced the rape as if they were floating above their body, feeling sorry for the woman being assaulted beneath them. And when something like that's happening to your body, it's an adaptive response to disconnect from it. You don't want the big picture there. You just want to get through whatever is going on. And so many assault victims are very clever about what they do. So, but you can help them with hypnosis to reconstruct that experience so you can fill in the gaps in what their experience was. And one of them is often blaming themselves, feeling as if somehow I should have known better than to walk to the drugstore at 3 p.m. where this guy attacked me in the park. Or I had a woman who was, it was an attempted rape, and she was badly beaten by the guy. She had a basilar skull fracture eventually, but she fought him off, but felt terrible about having gotten into it. And in hypnosis, I had her picture body safe and comfortable. That's one very important thing in using hypnosis, is you're reliving it mentally, but not physically. Your body is okay. So you get your body in a bath, a lake, a hot tub, or floating in space. Just feel your body being safe and comfortable. But picture one aspect of what happened. And on the left side of the screen, she pictured, she said, if this guy succeeds in getting me up to my apartment, he's not just going to rape me, he's going to kill me. So she, in a way, you think, oh, thanks, Spiegel, you're making her even worse. It was bad enough she was physically assaulted. But she was able to tolerate that. And then I said, on the other side of the screen, picture one thing you did to protect yourself. And she said, you know what? He's surprised that I'm fighting that hard. He didn't think I would. So she emerged from that giving herself credit for having saved her life, that she was feeling guilty for having gotten beaten as badly as she was, and she realized she probably saved her life. And so you can help people fill in the gaps around the edges of the dissociation and see things that at the time you probably didn't want to be thinking about. You just wanted to survive, but later on helps you put it into a broader perspective. And so dissociation is not a bad thing. We do it. Some people get caught in it and don't control it. And it's really how much can you control the dissociative experience and how much not. And there are people with extreme disorders like dissociative identity disorder where they do that all the time and they don't feel they control it, and you have to teach them how to. But a certain amount of dissociation goes on in everyday life and is perfectly normal and useful.
Yeah, I have such compassion for people who have had those traumatic experiences and dissociate. And I recognize that as the brain's way of protecting itself. It's so interesting to me that it seems to be a reoccurring experience from people who have had like sexual abuse or a traumatic experience, that they blame themselves. What is that about?
Well, Arlena, one of the toughest things is that as humans, we'd rather feel guilty than helpless.
Oh.
The experience of being made into an object is just terrifying. Suddenly, in a car accident, suddenly, the car starts skidding and you're no longer controlling what it's doing and what's happening until you hit something. It's a way of imagining that you could rerun the movie with a better outcome, that if I only did X, this wouldn't have happened. And so people cling to this idea. We don't let go of our sense of agency very easily. And unfortunately, one way some people do is with substances, that they'll drink until they're diluting their sense of agency. And in a sense, if you feel guilty, you may associate, Arlena, your agency with a sense of false responsibility. That is, well, you see, when I had control, look what I did. My father beat me up again, or my husband beat me up again, or something. And so you want to disconnect from agency, thinking that'll keep you from making more trouble for yourself, when of course it does exactly the opposite. You wind up creating more trouble for yourself. Agency is not the enemy. It's understanding where you had agency and where you didn't. And so letting go of agency may seem like a way of protecting yourself, but of course it turns out with alcohol and other substances to be the opposite.
Yeah, no, I experienced that in my own life. I had a very shame-based identity when I was young. And I sort of leaned into it like, well, if I can't be good, I'm going to be good at being bad type of thing. I
Yeah.
had like this real rebelliousness about it. And, but it did create this downward spiral
Right.
in terms of my self-esteem and identity. And I think, I would say half my listeners are probably like in early recovery. They're sort of addressing the crisis of, alcohol. And we're going to talk about the Reverie app because I know you have some tools to address that.
Right.
But in the beginning, first they handle the crisis of getting the drinking under control or, through abstinence mostly. And then the other half of the people, once they resolve the crisis, are really thinking about, they're in this process of reevaluating their identity. Like for me, I was the party girl. I was just wild. I was just, then I had all these shame-based labels too. Like I'm not good enough. I'm less than, never smart enough, never, so I tried to overcompensate with like achievement and looking a certain way. So I'm wondering, what are your thoughts on, as we go through this process, is it possible to use hypnosis to change our identities so that we can build our self-esteem and really bolster, like get rid of that idea of that I'm not good enough?
Yes, there are ways to use it for that. Your story about yourself reminds me, there's a great country song called I Want to Do Right, but Not Right Now. But you see, part of what you were doing was saying, if there is this, I think, if there is this sort of label about me that, I'm bad and deserve the shame, I'm going to own it.
Yeah,
I'm going to
100%.
have a sense of agency
Yeah.
over something that I don't really have that much agency about, because some of it is what other people conclude about me, not who I am and what I do. So you're kind of missing your feeling of agency, but you figure if I'm stuck with one of the two, I guess I'm going to have to own the bad one. But you don't have to own the bad one. So if you want to have agency, yes, but then the issue is how you can use hypnosis to help people with that. And one of the principles of changing behavior that's most important is what's called intermittent positive reinforcement. So if people keep telling you don't, if I tell you don't think about purple elephants, what are you thinking about? So instead, you want to focus on what you're for, on something you can genuinely feel good about. And so if you want to go back to your history of the last 3 years of not remembering a lot of what went on and getting into all kinds of trouble and forgetting to do things you should have, instead, you want to, if you keep thinking about that, it will have a predictable result, which is it'll trigger that same circuit in your posterior cingulate cortex that says, I'm an irresponsible, bad person who did this to someone and forgot that and did all kinds of terrible things. That's not something you feel reinforced by doing. So instead, what we try to, with the narrowness of focus in hypnosis, I try to get people to think about something they can immediately feel good about rather than bad about. And that is, I'm going to focus on my role of respecting and protecting my body. So I'm disconnecting them from like, who am I as a person at this point? And just saying, well, think about the way you cared for your kitten or your baby. And think about, it's easy to affiliate with a sense of responsibility for a dependent creature than it is to think about the complex history of your own life and how people treated you and what that means and all that. So you say, for my body, alcohol's a poison. And so you get them to focus just on that concept. I need my body to live. I owe my body respect and protection. So what you're doing now is making a commitment not to change who you are, not to change what your mother thinks about you, but to change right now the stance I'm going to take in respecting and protecting my body. And it is something that most people have a natural positive reaction to and have done it in other circumstances, but somehow we don't think about our body as the creature that is most dependent on us. Your body has to take into it anything that you put into it, even if it's damaged by it. It can't tell you in words, it tells you through difficulty with maintaining consciousness, through difficulty with motor control, through damage to your liver, through lots of things. That's your body's way of telling you it's being damaged. but it has to take into it anything you put into it. So you immediately start thinking, okay, if the place to start is respecting and protecting my body. And the problem when we think, oh, well, I'm just doing it to myself. Well, you are, but when you think that, you also think the moment I stop, everything will be fine. Except your body has a longer memory than that. And the things you've done to your body are going to be around for a while, if not forever. So if you use the dissociation in an odd way, Arlena, to distance yourself a bit from your body, to think, I'm not the same as my body, but I can't live without it. Then you think, well, then I'm in a position of responsibility over my body and what goes into it. And that I can control. And so, and then you can immediately start feeling good about controlling it. And are there cravings? Maybe, maybe not. You know, we all have cravings to do things that we don't do. And the fact that you crave it doesn't mean you need to do it. And in fact, one of the most important findings from National Institute of Drug Abuse is that for many addicts, the process of chasing the drug, the chase is better than the catch. That people get more pleasure out of sort of experiencing the path to the next hit than they do to actually taking the drug. That the drug experience itself is kind of an afterthought. It's the process you associate in this mesolimbic dopamine pathway in your brain, pleasure with just the thought, I'm going to get it again. And so you may have a craving, but the craving is not all pharmacological. Some of it is, but some of it isn't. It's psychological, and you can just say, okay, there's a craving there. But that doesn't have to be a gun to my head. It can be a thought. And I will weigh that thought against how good I will feel right now if I make a commitment to respect and protect my body, the way I did when I had a child, and respect and protect the child. So it's a way of using the dissociation to cut you loose from assumptions you have, which is if I feel like I want it, I have to have it, versus, okay, that's a feeling, but I also have a feeling when I think about committing to respect and protect my body. So we have people go through the self-hypnosis exercise. Anytime you have an urge, don't fight it, admit it, sit down or lie down, go into the state of self-hypnosis and reestablish your commitment to treat your body with respect, to focus on what you're for. And when you can do that, you can feel good from the moment you reinforce that decision to respect and protect your body.
No, I think that's so important. That's a very concrete, practical application. And I love that the Reverie app has short little 1 minute hypnosis sessions, and there is a longer one for the alcohol one, and I know there's some for quitting smoking as well, which a lot of people have a problem with. You know what I find really interesting over the almost 29 years that I've been sober, I've seen people coming into like 12-step rooms with this, with just like such low self-esteem and self-loathing, that some people, I get the sense that their self-esteem needs to be bolstered because they don't feel like they're even good enough to receive the solution. They're so full of self-hatred and self-loathing. That's why I kind of come back to this idea that, these people need to practice some self-forgiveness and self-compassion, because I find that the alcohol is a symptom of a deeper problem, right? They're wrestling with things like trauma, and they have no coping skills. And so that's what the alcohol is. It was for me. It was a medication that frankly saved my life at one point, because I don't know if I would have been able to survive all the pain that I was experiencing if I had to do it without something to anesthetize that.
Well, yeah. First of all, I'm sorry that you had to go through that, and congratulations on your 29 years. But as you think back, Arlena, what was the turning point for you? What was it that led you to value respecting and protecting your body more than the anesthesia the alcohol was providing?
Well, the thing towards the end, the thing that saved me, well, I felt like, the alcohol, it felt like it was saving me, but it was, in the end, it was killing me.
Right.
Like it was killing me. And I just got sick and tired of being sick and tired. I had an incident, as they say. I had an incident with my older sister where I was physically abusive towards her while I was in a blackout. And she decided that she was going to go to Al-Anon after that. And I was so delusional. Like I was so self-centered, but I had no way of processing any kind of self-examination. I was shocked. I was shocked when she said she was going to go to Al-Anon. I was like, because of me? But that led me to start asking the questions. Am I an alcoholic? When did I cross the line? What about all the people that I surround myself with? Are they alcoholics? And it took me 2 years of trying to control it and manage it before I was like, I've shot all my angles and I have to try abstinence.
Right.
But that's how I got there.
Well, I'm sorry it had to get to that point, but in a sense, your sister modeled for you what eventually you needed to do for yourself, which was, to admit you were powerless over alcohol, and that if it seemed like a control mechanism, it wasn't. And she took it seriously, and that kind of laid a model for you to take it seriously. And she's saying, what you're doing is hurting me, and I can't tolerate it anymore. So hopefully you get to the point. And she sort of prepared the pathway for you to do it, which
yeah, I mean, it was like she burst that bubble of denial. It's like I couldn't deny it anymore.
Right.
And then even though I saw it, it was very difficult to really accept the idea that I was going to have to practice abstinence for the rest of my life, which is, why my podcast is called One Day at a Time, because that was sort of like the mental trick I needed to, because I was like, how am I going to get married and not drink champagne at my wedding? That's such a silly idea, but I couldn't wrap my head around forever, but I could wrap my head around today.
One day at a time. That's right.
Yeah.
And it does point out, by the way, that even with people who have a serious drinking problem, there are times when they're more sober than others. And to use a good therapeutic technique, you need to be sober enough, hopefully brain clear of alcohol for a while, to think it through and act on it.
Yeah.
And one of the ways that people get immobilized with alcohol is that even if they have a good idea and good intentions, when they've got alcohol on board, their brains just aren't working very well. And so one thing you need to do to use techniques like self-hypnosis in particular is have your brain clear enough that it can do it. Because hypnosis is a function of a highly functioning brain. And so it needs to be able to work well enough that you can think clearly and manage it and feel the effects of doing it.
Right. I have often heard that addiction can be described as the narrowing of things that bring pleasure. And when people first start practicing abstinence, there seems to be this life feels a little flat for a while. How long does it? And it's my understanding. I actually interviewed Dr. Anna Lemke when she released Dopamine Nation, and it was like this. Yeah. She's amazing. I have her book on my shelf. But it was this idea that it takes a little while for the brain to sort of reach back to homeostasis, where the dopamine reward circuit is healed. How long does it take for that to get healed?
Well, it can take a while. I mean, you always, if you're alive, you've got dopamine, but you may be releasing it for the wrong reasons. You may have the wrong set of associations. You think, oh, if I only get to that next drink, everything will be fine. I'll feel good, rather than, there are multiple things that can give you a dopamine rush. Looking at a sunset, embracing your lover, playing with your kids. There are a lot of things that can give it to you. And you're right. That's a good way to put it, that alcohol abuse tends to narrow the things that give you that dopamine rush. But I do think that the way to start on that path is not just to feel bad about what you did, because that more often than not drives you back to another drink.
Right. Yeah.
But to ask yourself, who am I in a different way? Can I do something today that will make me, and that's the one day at a time, to make me feel good about myself. And that can be focusing on, from today, taking on a different sense of responsibility for what goes into my body. You wouldn't expect your car to drive you very far if you put sugar in the gas tank. You can't expect your body to take you very far if you're putting this anesthetizing poison in your brain. So today I'm going to do it one day at a time. but not do it by saying don't drink, because that's like, don't think about a purple elephant.
Right.
Don't think about not having champagne at my wedding. Think instead about how good I'm going to feel if I'm today taking good care of my body, if I feel like a good parent for my body today. And that's something you can genuinely feel immediately good about. And while you're right, there's some dopamine depletion and problems in people who have substance abuse, you've still got dopamine in your brain. You can use it. So use it to have a genuine reason for feeling good today. And it's not just about not drinking today. It's about what you are doing, about all the things you can do today to respect and protect your body. And one of them is to keep alcohol out of it. But another one is to eat well, get a little exercise, give your kid a hug, do a bunch of other things that make you feel good today.
Yeah, there's this idea, what you think about, you bring about, right? So if you focus on the target that you want to hit, not on all the space around the target.
You focus, that's right, on what you're for, not what you're against.
I also wanted to ask you, there seems to be some confusion around, or maybe there's some similarities and some differences between maybe guided meditation and hypnosis. Can you maybe go over that a little bit?
Sure. Meditation is a really interesting state, and the widespread acceptance of this Eastern Buddhist tradition is very interesting. Meditation involves, three major components. One of them is just open presence. Rather than fighting feelings or experiences, just let them flow through you like a breeze blowing by or a wind or a storm passing by. Don't judge it, don't fight it, just experience it. The second is using that open presence to examine your body, do a body scan and see how different parts of your body feel. Kind of get reacquainted with your body, because our bodies are strangers for a lot of us, but especially people with alcohol problems. And the third is compassion, feeling a sense of compassion for other people, but also for your own body, for what it's been through, and for how, if you really take some time to feel compassion about your body, you will feel compassion for all the things you've done that, it didn't deserve. And so, but mindfulness, it's Eastern. That is the whole idea in Eastern, is to step away from intentionality, from, this is, I'm who I am, I'm David, I want to do this, I want to be this. And researchers have found, Judson Brewer at Brown has found that experienced meditators turn down activity in that posterior cingulate cortex, the part of the brain that is this one of the centers of the default mode. So, and it makes sense. You want to sort of let go of your individual personhood and just be, being rather than doing. And experienced meditators have less of that activity. But meditation is meant to be just a general way of being. So there are a lot of people who will go around and proudly say, I'm a meditator. There aren't many people who will go around and proudly say, I'm a hypnotized person.
No,
and hypnosis is Western. It's more problem focused. So with mindfulness, you're supposed to just do it maybe half an hour twice a day or something like that, just to be different. With hypnosis, you do it for a purpose: to stop smoking, to reduce anxiety, to handle stress better, to control pain. And so it's quicker and more focused. And it's a similar state, but it's not the same. So with mindfulness, you're not necessarily turning down activity in the salience network. You're not necessarily increasing connectivity between the executive control and the mind-body insula part of the salience network. So it's it's related, but it is not the same. And so the Headspace, which is a major mindfulness app, it says that after 3 weeks, the people who use them are 16% happier. With hypnosis, we find that people can significantly reduce their pain and their stress levels in about 15 minutes. That they can take 19% of the people that use it stop smoking. And so it's something where it's much more a problem-solving tool rather than a kind of mental place you want to go to all the time. It is. Most people find it pleasant, but that's not the goal.
That's very different goals. And that leads me to I want to talk about the speed of effectiveness, because those of us with addiction issues, we're not great at delayed gratification,
Yeah.
And what I find so interesting about hypnosis is its effectiveness. And there's a lot of us that go into therapy once you sort of go down the road of recovery. And I have this study in front of me, Dr. Alfred Barrios. He compared psychoanalysis, behavioral therapy, and hypnotherapy. And it was so interesting to me that the effectiveness of hypnotherapy was 93% recovery after 6 sessions, as compared to psychoanalysis that was only 38% effective after 600 sessions. That's crazy, right?
Right.
That's just one study, but I just thought that really spoke to the effectiveness.
Well, yes, it does. And it's why my late father, who was a psychiatrist, hypnosis is something of a genetic illness in my family. Both my parents were psychiatrists and psychoanalysts, and they told me I was free to be any kind of psychiatrist I wanted to be. So here I am. But he found that he learned to use hypnosis in World War II to help soldiers with pain and combat stress reactions. And he then went back to doing psychoanalysis, and he found he was getting a lot farther with many, many fewer sessions, teaching people to use self-hypnosis. So there's a value to self-knowledge, but I do think it's kind of a trap, particularly with addictions, where every day you're doing more damage to your brain and your liver and other parts of your body. That even if it worked, if you have to do it for 3 years, 4 days a week on the couch, it may be too late by the time you get there. And I think this idea that you're sort of trapped in that if you don't understand how screwed up you are, you can't improve. And that's just not true. It may help, and it may be a good thing to do on the way or once you've gotten there. But the crisis problem is something that you're every day putting poison into your body that is making you more likely to carry out the old patterns than less. And if you clear your brain long enough, you can use techniques like hypnosis to detach from your old patterns, to say, whatever it is that led me to do that, I don't want to do it anymore. And then maybe you'll learn about how, when you get some distance from them, you may be able to understand it better. But this idea that I can't, bring myself to stop drinking until I understand why I got there is an excuse for just being stuck in the mud even longer. And so what we do with Reverie is teach people how to use self-hypnosis. It's an app that's available from the App Store if you have an Apple iPhone, or from Google Play if you have an Android phone. And you can see how hypnotizable you are. We have a test that you can take and see whether you're low, moderate, or high in hypnotizability. And whatever you are, there's a way of combining the therapeutic strategy with your degree of hypnotizability that can help you make the best use of it. And we then teach you an exercise, and it's interactive. So I'll ask you a question. You'll hear my mellifluous voice. I'll ask you a question. You'll give me an answer. We analyze what your answer means, and then I give you the kind of instruction I would in my office to take the next step that is most likely to help you. And we teach you an exercise to practice. If you need to, every 1 to 2 hours, anytime you have an urge to drink, don't fight it, admit it, go into the state of self-hypnosis, get your body floating, and then carry out your intention. As you say, if you can if you can picture it, you can do it, and give yourself another prompt to focus on respecting and protecting your body rather than fighting drinking. And so people are welcome to try it. Lots of people have tried it. There's a website, www.reverie.com, if you want to read about it more and learn about what we do and how we do it. And the app itself has a lot of explanation as well, but you can get right into doing the exercise and seeing how it feels.
No, I I personally love the app, and we would be remiss not to mention the Reverie community.
Yes.
I have attended some of the workshops.
Have you? Cool.
Yeah, I think I wrote down her name, Shelby.
Yes.
I wrote her
Shelby.
name down somewhere. I can't. find it at the moment.
Yeah.
But yeah, so I've attended some of her meetings because there was like
Yes.
a work, goals workshop because, okay, so let's say that the crisis of addiction is resolved and you're sort of like, like people like me that are sort of on the path of recovery and we're trying to sort of rewire our brains. What I think is so interesting, you mentioned detaching from old patterns. And what I think is so interesting, it's like we all know what we should be doing. I know I should be drinking lots of water and sleeping 8 hours a day and exercising and doing all these meditation and self-hypnosis. But I find that even though we know what we should be doing, we sometimes self-sabotage. We're like stuck in these patterns, or we want to do something. Like I've been stuck on this manuscript that I've been writing for a while and sort of find this self-sabotage pattern happening. How can I break that? Can you heal
Well,
me? If you could just fix me, that'd be amazing.
yes. Sure. And part of it, Arlena, is the exercise, doing the exercise itself should be its own reward. You should wind up feeling better, saying, okay, I don't know whether I'm going to be able to carry out my plan to, write another 5 pages of this thing, but I feel good when I do the exercise. So you go into the state of self-hypnosis. Imagine you're floating in a bath, a lake, a hot tub, or floating in space, and picture on an imaginary screen somewhere you enjoy being. It might be a favorite vacation spot or a hike or a swim or something you like to do. And you notice how quickly and easily you can use your stored memories in your imagination to help yourself and your body feel better. So you start out not feeling you're depriving yourself of anything, but feeling you're doing something that makes you naturally feel good. And then you can picture, okay, so what will make me feel even better if I get it done in the next few hours? And picture how you would feel when you've written the 5 pages and how good that will feel. And it's a way of luring yourself into doing the right thing rather than forcing yourself into it. You can see, I will feel a lot better if I did it. Or think about the last day you did that and how good you felt when you finished that piece of work and went on to something else. So it's a way of giving you the immediate positive reinforcement that we all need to move ahead in life.
It's just amazing how a simple shift in perspective can change the outcome dramatically.
That's well put, and it's exactly right. Perspective is important. It's a shorthand for doing what you need to do in life, and a lot of the things we do, it's because we know we want to be a good parent or do well in our work or keep the house clean or whatever it is. But sometimes you can get trapped in it, and sometimes, particularly as you say, if you have this sort of perspective, I'm a loser, I'm going to screw up everything I do, I shouldn't even try because I'll just make it worse. What you're doing is digging yourself deeper into the quicksand. And that's a situation where being able to cut loose from your traditional sense of who you are and what you do can be a real benefit. You just say, it's sort of allowing you to write on a fresh page and just see where you go and to choose what you want to affiliate with and be for rather than what you're against.
Right. It's so funny because those negative thoughts of, maybe public criticism or things like that, it comes so quickly. So it sounds like the self-hypnosis is a conscious practice of focusing on the feelings that of like having already accomplished it.
Yes, focus on what you're for. And part of who you are is what you've done, and that's not always pleasant. But part of it, you've done some pleasant things, so give yourself credit for that. But part of who you are is where you're going, where you're heading. And so your past is not the total determinant of where you're going to be. Your future is too. And one thing people need to realize is that even though if they've made many mistakes and gotten stuck in the mud a lot of times, they have the potential to be someone different, the way you became someone different. But some of it is, the hitting rock bottom thing that AA talks about. But some of it is saying, I don't have to land on the bottom before I decide that who I want to be is a part of who I am now. And I can affiliate with that and not just where I've been.
Yeah. And I feel like that goes back to the shaping identity. Like, there's part of acknowledging who I really am. Like, I'm never going to be an NBA basketball player, right? So that's Five,
right?
54, 5'3". I don't think that's going to happen. But having realistic expectations of what I can accomplish is
Sure.
important. You mentioned something, and I did want to touch on this because a lot of people in recovery don't want to take things like pain medication. And I have heard you talk about how, hypnosis can allow us to access abilities that we may not realize we have, like the ability to control parts of our body physically. I know you tell a great story about like why you decided to go down the road of hypnosis with the girl with the breathing issues.
Sure.
And I know you have done a lot of work around helping cancer patients.
Yes.
I'm so curious. So for the people who have like chronic pain,
Right.
who are trying to practice abstinence, how does hypnosis work to address that?
Sure, Alina. Well, the summary line is that the strain and pain lies mainly in the brain. That is,
That
you
sounds
may,
familiar.
yeah, you may, twist your ankle and signals go through, up the spinal cord to the brain. The brain decides what those signals mean. And to give you an example, right now, I can see you're sitting on a chair. Hopefully, you were not at all aware of the sensations in the parts of your body touching the chair. If you were, we can just stop the interview right now.
There's that Spiegel sense of humor.
But you know what? Your brain decided that those signals were irrelevant, and I'm not going to pay attention to it. And after a while, it can hurt if you're just sitting in the same position. But your brain says this is not a problem. The brain, we are pretty pathetic physical creatures. We don't run that fast. We don't smell that well. We don't see that well. We don't hear that well. And so one of our major defenses was being able to control pain, because predators detect motion. That's how they say something's alive and they want to follow it. So if you have the ability to modulate your reaction to even when you're injured, you have a better chance of staying alive. And so this 3-pound organ on the top of our bodies, one of our major advantages is forming and maintaining social relationships and modulating our perceptions. So that's an advantage. It's not a disadvantage. So if you've really just broken your ankle, you better do something about it. Or if you're having crushing substernal chest pain, you better get to an ER quickly. You may be having a heart attack. But a lot of pain, you know what it is, but our brains often respond to all pain as if it were acute pain. So, oh my God, there's a new feeling here, even though people who have like a chronic joint problem or something know it, and moving it actually makes it better. People with arthritis, they actually feel better later in the day than they do when they first wake up, because they're moving the joint more and feels better. So pain is not always a bad thing. And the brain can decide how much attention you want to pay to the pain and how much you really don't need to. And so we did a randomized trial published in the British medical journal, The Lancet, in 2000, 241 patients they had to be conscious during the procedures. It was a cut down into the artery, and you were doing chemoembolization in the liver or visualizing arterial stenosis. And there were 3 conditions. The first one was standard care, which meant you had an IV, you could push a button and get opioids during this procedure. The second was that plus a friendly nurse giving you the kind of social comfort that helps people. And the third was hypnosis. At the end of an hour and a half, these procedures took about 2.5 hours. The hypnosis group pain level on a 0 to 10 scale was 2. The standard care group was 5. And the friendly nurse group was in the middle, was about 3.5. If you looked at their anxiety scores, at the end of an hour and a half, the standard care group was 5. The nursing group was 3. And the hypnosis group, I was afraid they were all dead. They had no anxiety at all. They were doing fine.
You had to check for heartbeat.
Right. The staff was feeling better, and they got done 17 minutes quicker on average, just because they weren't watching the patient obviously suffer. The hypnosis group used half the amount of opioids that the standard care group did, and they had far fewer complications that were often drug related. So at the end of this randomized trial, they got done quicker, they were happier, they were less anxious, they had half the pain and half the medication. And now if you published a finding like that with a new drug for an anesthetic, every hospital in the country would be using it now. But people just have trouble believing that the brain is that good at managing pain. I had a young woman who came to see me who was pregnant. She was 7 months pregnant. She had really bad lower back disease. And so as the baby got bigger, her pain got worse and they couldn't give her medication because she was pregnant. And she'd had a nerve stimulator implanted that didn't help. And she was 7 out of 10 on pain when we started hypnosis. 15 minutes later, she was 3 out of 10. She said, I can live with this, and she looked angry. And I said, what's the matter? She said, why in the hell are you the last doctor I got sent to instead of the first?
Exactly.
And so people think that pain is all bottom up, and it is not. The brain helps you decide how much pain you have. So you can have, one thing I often do with hypnosis is have people imagine that they're in a physical situation where they get pain relief. So a lot of people with joint pain, for example, think a warm bath is wonderful. So I say, look up, close your eyes, take a deep breath. And now imagine you're in your bathtub and feel that sense of warm, tingling numbness penetrate deeper and deeper into your body and let it filter the hurt out of the pain. And a lot of people can substantially reduce their pain doing that. Not everyone can get rid of it, but a lot of them can reduce it. You pay more attention to pain, it'll hurt more. If you can focus on it, you don't say, I won't feel pain. You say, focus on a competing sensation like warm, tingling numbness. Or with some people, I have them imagine going somewhere else, go to your favorite beach and just feel the warmth of the sun on your body. Leave your body here and go somewhere else. And some people that helps. For some, I use the sort of more meditative approach of feel compassion for your body. Many people resent their bodies. You're dishing out hurt all the time, and say, your body is doing the best you can. Think of your body as if it were your child, and comfort it. If your child were hurt and were crying, would you get angry at the child? No, you would try to comfort them, and do the same for your own body. Or try to move the pain around. There are lots of techniques we can use, but it can substantially help people with pain. And in the old days, before ether anesthesia, hypnosis was a major anesthetic during surgical procedures, 80% surgical anesthesia with hypnosis. So the brain, it's taken us a long time to remember that the brain is the major regulator of pain experience, and you can control your brain doing that without resorting to drugs.
That's amazing. I wonder, I've kind of had this idea. I talk a lot about self-esteem and building self-esteem. And I tell people, it's something that you practice. It's like you wouldn't go to the gym once and expect to stay in shape forever, or eat one salad and think that you're going to be thin for life. Is this something that is practiced on a regular basis?
Absolutely. Absolutely. And so I tell people, anytime you feel an urge to do something you're worried about, don't fight it, admit it, but sit down or lie down, go into the state of self-hypnosis and focus on this principle of respecting and protecting your body, or control your pain that way. And the nice thing about hypnosis is you can do it pretty much anywhere except when you're driving your car, unless it's a Tesla with autopilot. I'm not so sure about that either.
I'm not so sure.
And focus on your ability to modulate your impulses to do things, focus on what you're for, and modulate things like pain. And you can do it in 5 minutes, and you should do it, particularly at the beginning, very regularly, so that you understand how to do it, you can feel it inside, and you know how to get there quickly and effectively. And then anytime we did one randomized study with women with metastatic breast cancer. We met weekly in a support group, helped them deal with their fears of dying and death, helped them learn that they had resources within themselves to help others, like in AA, for example, and taught them self-hypnosis for pain control. And by the end of the year, the women randomized to the group rather than standard care had half the pain the control group did on the same and low amounts of medication. So you can use it for chronic as well as acute pain. And patients would say, before, when I got some new ache in my chest, I was sure I had more metastases, and it would freak them out and it hurt like hell. Say, now I just do the hypnosis and cool, tingling numbness, and I feel okay. So it works well for chronic as well as acute pain.
That's amazing. I'm not going to keep you too much longer, but there were
Yeah,
two things I was kind of curious to get your
sure.
opinion on. One was age regression, and the other one was past life regression. I know you probably have some
Well,
thoughts about the past life regression.
I do. You know, I'm waiting for somebody from one of my past lives to tell me what I should think about it. And so far, I've had no messages.
No
I,
evidence.
you know, because hypnosis can cut you loose from ordinary perceptions of yourself and ways of thinking about things, it can also, you know, cut you loose from the plausibility test that I may think I'm having an experience. Like if I tell someone, you know, you're on the beach, you know, your favorite beach in Hawaii, watching the sunset, you can have that experience pretty intently and enjoy it without necessarily believing that you were there in a past life. And so the sort of vividness of the experience doesn't necessarily attest to the reality of the experience. So, and I think in hypnosis,
I think falling in love can be like that too.
yeah, absolutely. And hopefully you chose the right person,
Yeah.
but it is like that. It is hypnosis.
Yeah.
You know, we use terms like that. I feel
Yeah.
entranced. She mesmerized me. You know, we use those hypnotic like terms because suddenly there's nobody else in the world.
Right.
Everything about that person is wonderful.
That's amazing.
And hopefully, more often than not, that's right in terms of falling in love.
Yeah.
But love is a trance-like experience.
It is,
where
yeah.
you sort of let go of all the other things you thought you were, the other things you thought you needed to do, and just get absorbed in the relationship. And it
Yeah.
comes to define you more. That is a hypnotic-like experience, and that's a good one.
Yeah.
But so I think past life regression is a fantasy. It's not a reality. It's a believed in. Hypnosis has been called believed in imagination. And so while you're experiencing it, may seem real, but it doesn't mean it is. As far as, you know, regression, hypnotic age regression, yes, that can happen. I've had people who can relive experiences earlier in life, including one was a Stanford student who was very hypnotizable. And I had him go back to being, you know, a few months old just to see what would happen. And normally when people do that, you know, you tickle them under their arm or something, they start to giggle and, you know, they act like a baby and they can't talk, you know, they just sort of, you know, act out what it was like to be a baby. But this kid started to cry and I didn't understand what was going on. So afterwards we came out of the self-hypnosis and I said, did something happen to you when you were a baby? And he said, well, of course, I don't remember this, but my mother tells me that I had an abscess, a really bad infection under my left arm when I was born, and I had to be on antibiotics for a while. And so I happened accidentally to be tickling the part of his body that was causing him pain at the time. And that's why he was crying. So I think we do have these earlier memories. They're nonverbal. You know, we start to have episodic memory at about age 3 or 4. You know, that's when you start to remember having done things. And it's shortly after we develop speech. So, you know, we have a verbal framework for understanding what we remember. But it doesn't mean that the part of the brain, the hippocampal gyrus that lays down memories isn't working. It just means that it's not working in the same way as it does when we can explain and discuss what it is we've experienced. So I think there are ways of using hypnosis to just intensify your focus. You know, use a flashlight in your memory basement and see what you can remember a little more intently. And sometimes you can. It doesn't mean that what you recall is true if you recall it under hypnosis, but it doesn't mean it isn't either. And it does help some people recall things that otherwise they had difficulty recalling.
Yeah. Wow. It's so fascinating how the brain works and how we can, I mean, I've heard you say before that we were born with this brain, but we don't have a user's manual.
That's exactly right.
But it seems like we're getting closer.
Well, I hope so. I hope so.
Yeah.
And people can read the manual and use it better or listen to it.
Well, you've been putting out such amazing content. I really appreciate the research that you're doing. that
Thank you.
helps people to heal. I mean, anybody that's a healer has a soft spot in my heart. So I just want to
That's
thank you
nice.
so much for all the
You're
work
welcome.
that you've
Yeah,
done, and for spending time with me here today.
happy to do it.
If people are interested, so we're going to encourage people to look at the Reverie app. I'm not paid or
Great.
sponsored or
Yeah,
anything for it, but I find
thank
it
you.
personally very helpful. Do you have a
I'm glad.
roadmap of future features or additional meditations you're going to include?
We have one coming online pretty soon for fear of flying. A lot of people, I think it's like
Yeah.
15% of people who would ordinarily fly are too afraid to do it. So we have
Wow.
a self-hypnosis exercise to deal with fear of flying. And that's the next one that's queued up. We're working on others now.
Yeah,
But
if I can put in a vote, I would vote for a self-esteem, or like, I'm good enough.
that's an interesting idea. That's an interesting idea. Well, you certainly have helped pave a pathway for people to feel good enough, and I admire the work you're doing helping people
Thank
deal
you
with
so much.
addiction. Yeah.
That means a lot to me. And I'm just so excited about your work with all your colleagues. You have many fine colleagues that you're doing excellent work with. So
thank you. I feel very lucky. Andrew Huberman is one, and a
such
number
a
of others.
fan.
Yeah.
All my
he's great.
girlfriends love him.
Yeah.
He is charming.
He's charming. He's fascinating. And he has this combination of making it really enjoyable to listen to this very sophisticated discussion of the latest in science. He's just so good at that. It's really fun to.
No, it's so I'll have to admit that sometimes, he kind of gets into the weeds, and I don't care. I just try to follow along. It feels like it's something my brain likes to chew on. Like they're really deep concepts, but he's like a cool guy, a cool nerd, if that's a thing. He's a unicorn.
I like that. That's
he's
very good.
Yeah, he's a unicorn.
I'll tell him you said that. He'll get it.
Please do. I'm a huge fan.
Sure.
Well, Dr. Spiegel, thank you so much for your time today. And
You're welcome,
I look forward to all the work that you do.
Thank you. Keep up the good work too. Bye-bye.
Thanks. Bye.